Hello, my name is Dr. Maya Byfield. My business is The Phenomenal STEMist. I'm so excited to be here in Orange County because it's where I live. I live in Apopka, Florida. And I decided to make this business because I saw a need for underrepresented students to be successful in STEM, which stands for science, technology, engineering, math. And the best way I can do that is just provide products for parents to prepare them, whether it's a book or online STEM camps or just video podcasting. My goal is to transform this community, especially those who are underrepresented. And the way to do that is to help parents understand their children's minds and basically develop them at different stages of their lives to be prepared for a successful STEM career. Thank you so much. That's why I'm here. Hey, 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 it's the phenomenal STEMist. Hello, good evening, everyone. Sorry I'm a little late. The time just went away from me, but we are here, myself and Dr. Ken Stewart. We are in the house and excited to discuss with you an article we looked at. It's a .gov article, so it's supposed to be legit.
Oh, oh, yeah.
It's supposed, but I am it says an NIH funded study highlights the financial toll of health disparities in the United States. I have Dr. Ken Lewis with me, a graduate from Ken Lewis, sorry, Ken Stewart with me, a Oakwood College graduate along with me,
Yep.
and he's also a Loma Linda University graduate. He has his doctorate in public health. Ken, how are you doing?
I'm good. I'm good.
Good,
I'm
good.
taking it easy. I'm here on the West Coast. So yeah, I'm good.
Yeah, yeah, yeah. I'm still always excited and appreciative of people who decide to join me on this this stream. It's
Mhm.
not a lot of people that's brave enough to get online and just start dialoguing, but you have your own thing going on. You come on, I think every Wednesdays at I think 12:30 or noon, Eastern Standard Time. What time is Eastern Standard Time? Noon, right?
Sometimes it varies, but I try to come on once a week.
Yeah,
My time is at 9 o'clock. Your time is probably twelve
that's
o'clock.
right.
So because I'm on the West Coast, and we're 3 hours behind the
Yeah,
East Coasters. So
yeah.
yeah, I come on weekly.
Yeah, that's one of the reasons why we start at 8:45. People like, "Why so late?" Because I got people from all kinds of area codes, especially on the West Coast. So it's currently almost 6 o'clock your time, and it's almost 9 o'clock ours. So we're gonna get right into it. We're not gonna belabor the point. We're talking about a little press release. So it's not the actual body that supports public health for the United States of America, and
Yeah.
so it funds all kinds of research dealing with the health sciences, public health, biomedical health, all things. Thanks, shout out to the NIH. It paid for my PhD. I couldn't
Yep.
have my PhD for free if I didn't have NIH grants supporting me. So I honor the NIH, and they say, or at least a study funded by the NIH says, that there's a financial toll of health disparities in the United States of America. What, first of all, what is a health disparity? What's health disparity?
So the health disparity is basically the differences in health among populations.
Right.
Differences in health among populations. So the question now is, what kind of contributes? to those different health outcomes within the population. So you have genetics, you have access to care. Within those populations, you have poor quality of care, community features. So community features can be looked at as limited to no access of healthy foods, poverty, limited personal support systems, and violence. So that's all under community features. Then
Mhm.
you have environmental conditions, poor air quality. Then you have language barriers. And then last but not least, health behaviors. So,
So I'm in a storm right now, so there may sometimes be a little bit of connection issues on my part. But we still gonna roll through. You're
okay.
fully green, Ken. It's me that goes in the orange and red sometimes. So that just demonstrates that there might be some difficulty. But right now we're fully green, so we're good. So I like the way you said that community features that lead to disparities. So I was looking at economic. The first thing they showed there were key findings in this study. So there are
Yeah.
key findings. The first key finding is that the economic burden
Hmm.
of health disparities are borne by racial and ethnic minority groups,
Yeah.
right? Black and African Americans population are have the most economic burden because we our men basically it seems, but just, not just our men, but our primary breadwinners probably
Hmm. Yeah. Yeah. And you are right.
are
Yeah. Yeah.
dying.
Yeah.
Yeah, yeah, they're dying prematurely, and if they die prematurely, we lose that income. That
Yeah.
income from if you could if a man who's dying, I think the black man dies at 68 is what I'm hearing the mean or
Yeah.
median age range. That's young. Like you have 70s and 80s of social security, retirement funds, whatever pensions,
Hmm.
all of that stops. Social security and pensions, at least,
Yeah.
die with the person. See, retirement funds are a little different, but I don't think many African Americans have retirement funds. Many of them have pensions and social security. But if you die with that, that means you die. Like you don't. Your children don't inherit pensions. Your children don't inherit social security. So yeah,
And to add to that, yes, you have that burden, the economic burden of individuals dying, like probably before they even reach retirement age.
and even
But
yeah,
you also have the burden of that individual not living from 1920 up until they retire. So that burden is not just felt as they are dying later, or but not even um, dying
68. They're dying at
yeah,
45.
45 or 40, which goes back to the factors that contribute to the health disparities.
Yeah. Yeah. So if you're dying too early, right? Because that was just a mean, as Ken is saying. I was using 68 as the average. That's average. That's not the reason why it's so low. The reason why the average is so long. And shout out to people in math, right? And for mathematics, like if I have a test average of 69, it's not that everybody got a 69. It's that some people got a 90 and some people got 100 and very few people got a 99, whatever. But also some people got 20 out of 10 and 130, right? So then it leads to an average of 69 average. You see that? So there's a lot of people who, if you have an average death rate of 68, that's saying that there's a lot of people who are dying in their 40s. Look at the amount of rappers and popular people that we grew up listening to that have died in their 40s. And
Yeah,
people, yeah, you've lost all that income. All that income. So the economic burden is carried by minorities because of their premature death. And so so there must be some kind of problem with um their health, that they're dying so early. And it also says the excess of medical costs.
yeah.
Yeah. Man, man, man. All right. Anything else you wanted to say about that?
So as we kind of dig a little bit deeper as to, okay, what are some of the contributing factors? We talk
Mm-hmm.
about genetics, access to care, the environment, not just the environmental factors or conditions, but living in certain environments contributes to not just potential violence or fear, but also contributes to stress. So,
Mm-hmm.
stress and going to work in certain conditions and living in certain conditions. And then it goes back to what we spoke about like a month ago in terms of education. So, so the question is, as you look at the economics of health and wellness, it also has a direct connection to school, to education, because that helps to determine where you live and other factors too.
Wow. So basically, if I'm living in a neighborhood that is extremely violent, even if I don't die, the stress that it causes me to get sick early and have excessive medical costs. Is that what you're
Correct.
saying?
Correct. Yes.
Wow.
And even though you may get out, quote unquote, get out, those still those factors that created that stressful situation don't necessarily go away. It may go away from you seeing it, but there's still a perception of it potentially occurring as you leave. Because no matter where you go, there's still that if I get pulled over, you know,
Mm.
my heart rate may increase. Not
Wow.
not because of this just happening now, but of our body, and this is where epigenetics come in. Our body back in the day, years before, may have experienced something and our body reacted a certain way. Now 10 years later, you get pulled over. Those same factors can then occur again from a more biological perspective. Thus, you have your heart rate increasing. Thus, you are more stressed. So there are some connections to that.
So epigenetics, just to give a background, epigenetics is basically so we all have DNA, right? We all have genes, and we get
Mhm.
them from our parents and our parents' parents and our parents' parents. They pass genes down to us. Um, but those genes get regulated. They get turned on, they get turned off, right? What happens is that we are learning that genes that got turned on in not just us, but our parents and our parents' parents and our parents' parents, they might have gotten turned on because of some kind of traumatic event, and that change that happened because of that traumatic event gets passed down to us. So now, even when I don't experience the traumatic event, this gene still gets switched on, and I feel like I'm experiencing a traumatic event.
Mm,
So if my parents' parents were getting abused, brutalized through Jim Crow, now I don't experience Jim Crow, but somehow when I see the policeman, my heart rate is racing fast. I get hypertension. I get hypertension and cardiovascular disease because of my feelings inside of me biologically that are experienced
mhm.
through the something similar. I don't want to say that it's genetics. It's epigenetics, not the same thing. Because I also don't want people to feel that only black people get this, and the reason why we are ill is because of our genes, our inferior genes. No, there's something triggering this. Racism is triggering this behavior, and now I have hypertension because of the racism, not the so-called race. Because if you go to somebody overseas, right, and you go to somebody who has similar genes as I do, they're not getting the hypertension. They're
Hmm.
not getting the mortality rates, right? That the pregnancy mortality, maternal mortality rates. If you go to Africa, they do not have the same mortality rates as African American. There is something going on in the environment that's triggering these dangerous responses, and I want us to talk about that in the context of economics, because now I am getting hypertension at 45 when I shouldn't get hypertension until I'm 65, and now I'm, not me personally, but dying at 50, and now all of the income that I could be making from 50 to 65 is gone from my community. And we wonder why there's a wealth gap. There's a connection between health and wealth. That is what Ken is saying. Yeah, that's powerful.
Yeah. So as we now look at, okay, these are the issues. Economics directly affect our health, well, also our health is directly affects our economics. What can we do? Which goes back to, okay, yes, I may not be making a certain amount, or I may live in a certain environment, or um, my income may not be as high as I would like. What can I do? And what we can do is, one, we can focus on us as an individual and making choices as an individual. But then also we can look at it and say, hey, let's connect with our city hall and say, okay, what can we do to increase more safety areas, increase more parks, increase more walkways, build a bike trail or build a skateboard park, build more trees. That's from a policy level. And then on top of that, how can the city or state make some changes? But it first starts with what can we do as an individual?
You start out there with the state level. It was saying something that 5 states had the highest economic burden amongst racial and ethnic health inequities. 5 states. You know what those 5 states are? Listen: Texas, California, Illinois, Florida, and Georgia. Texas, California, Illinois, Florida, and Georgia. These 5 states, most populous and most diverse. But you know who's missing out of that? That made me say, who's missing? Texas, California. That's California is number one in size and
Yep.
population. Texas is number two. Florida is number three. But who's number four? You skipped it and jumped to Illinois and Georgia. Who's number four? Who's the fourth? Does anybody know the fourth largest state in the country who is not affected by this inequities? It's New York. New York. Did you notice that, Ken? That New
Yeah.
York was not one of the 5 states with the highest economic burden? Why is that? I think I know why, but I want to know what you think.
I think the reason is because you said Texas, California, where else?
Florida,
Florida.
which is the top three,
Yeah.
but not New York, which is four, and then it's Illinois and Georgia.
Um, that baffles me right now. But what I think may be a factor, and I didn't study this, was possibly due to services, not getting the services from the states or from the state to provide for those who are in need. That could be one factor. Yeah, that's one factor that comes to mind. And creating policies from a from a policy perspective, but also um, on the other side, I know New York has the different programs needed in comparison to Georgia or Texas or Florida because of their increase in Medicare services. So I'm not too sure. Property values, because property values are very high in New York.
But so is it in California.
Yes,
I
that is.
think I think it's because of the services provided. I think New York provides lots of services.
Yes.
Specifically, it is a strong New York had always a strong emphasis in public health. The
Yeah.
New York City Public Health Department is I think one of the best public health departments in the world.
Yeah.
It's public health. There is affordable health care for New Yorkers. In California, there's a lot of taxes. I think more taxes than New York. How come they're still having issues? Florida, Texas, Georgia, they're red states. They're not into public health. They don't have taxes. They don't have state taxes. State taxes are usually what helps to provide for public health services. So I
Mhm.
don't expect the 3 out of 5 red states to have. That's why I expected with them. But California, you pay all these taxes and you still have these strong inequities. I was
Um,
like, wow.
yeah, my thing is probably mismanagement. I'm not too sure, but at the same
Mhm.
time, you have some good schools here. So yeah, that baffles me. I don't know how come it's very high in these two in this blue state that I live in right now.
Yeah, yeah, yeah. All right, so I was looking at the largest states by population: California, Texas. I swear, we need to find out what the largest states are. By population, I don't know, but I think it has to do with provide services. Services. All right.
I can tell
So,
you. Let
okay.
me tell you real fast.
Yeah, yeah. Top
Texas,
five:
Florida, California, Texas, Florida, New York, Pennsylvania, Illinois.
Pennsylvania, and Pennsylvania is not in the list. Pennsylvania is
Yeah,
number 5, but it's not in the list. Illinois is in the list. It makes sense. It's number 6. Where
yeah,
does
number
Georgia
6. Yeah,
fall? Where does Georgia fall?
Number 8.
Right. So so I understand there's a lot of people there, but in spite of the number of people in Pennsylvania and New York, healthcare is provided at.
Yeah.
I think, but there could be other reasons. All right. So the next one is economic burden by education. I'm sorry, something in my
That's
throat.
okay. Yeah.
Go ahead.
So what I found that the group that is affected the most are individuals, and I saw it in a JAMA report that was done by Thomas Levis and his crew up at, I think it's Tulane, Thomas Levis. And he showed that in JAMA showed that the population that that um that has the highest economic burden are individuals who do not have at least a high school diploma or below,
I want you to listen to that. If you
or a GED. If they have a GED, they have the highest economic burden as well as those who do not have a GED.
so if you don't get a high school diploma, if you drop out of high school and get a GED or don't even complete it, you hold the highest economic burden. You have the most issues of health disparities. Listen to me. And that is probably who are the ones that don't go get an education. Who are the ones that drop out of high school? There's a link between your education levels
Yep.
and how well you do health wise, and therefore how well you do financially, right? So and that was powerful. The more education you have, the less health inequities you have. What do you have to say about that, Ken?
And I agree because it's very hard. Um, because some people, when you don't have at least a high school education and you start moving up the ladder, you tend to become more stressed. When you become more stressed, you tend to increase in weight or increase in hormones. These hormones now contribute to you producing cortisol, you gaining weight because you're stressed. And then on top of that, the focus is I need to get a job, and those jobs may not be jobs where you have union jobs. These jobs are Hey, I just got to get something. I'm not as qualified, so let me take what I can get. So now you just picking these one or two jobs, and whoever is hires you, they know that they can do what they want per se, but you're doing what you can do. And then that opens up the opportunity of, okay, where can I live now at this low income? When you go certain places. So it kind of stems from education in some respects.
Yeah, if you don't have education, you don't have a lot of money, you don't have health care, right? Health care, you don't get provided good health care. You may get some health care, but that health care, I know people who get certain types of health care where cardiologists don't take them. They can't find any cardiologist to take that specific type of health care. Right?
Yeah, well,
Here in Florida, not one cardiologist in Florida takes that specific type of healthcare. So if you have heart disease and you don't have, and you only have Medicaid healthcare, meaning Medicaid is where you're in poverty, you can't get, you could get a regular physician, but you're not going to get a cardiologist. And if you can't get a specialist to deal with your special specific type of need, then you can't get the healthcare that you need.
which goes back to the premature mortality because you don't get the service you need, and it could be just, let me put you on some meds, it put you on some beta blockers, let me put you on some X, or let me give you metformin to be able to help you manage your blood sugar. Not Wegovy, Ozempic,
Uh oh.
something. Yeah.
Uh
So
oh.
so yeah. So or let me refer you to somebody to help you with your lifestyle.
Any of that. You're missing out on that. So,
Yeah.
guys, education is critical. It says per person. Look what the message says. In per person, the economic burden of health disparities substantially across the states varies substantially by education levels. Adults
Yeah.
with less than high school diploma range from $3,152.
Hmm.
You see that? That's
Yeah.
extreme
Yeah.
poverty. Extreme poverty. In 31 states, if you had less than a high school diploma, um, 20 states was the greatest amongst the less than a high school diploma. So most people who had health disparities or health inequities are those who did not graduate from high school. I feel like high school diploma was my most important certificate because if you
Mhm.
can graduate from high school, you can lessen your chance of economic burden because of healthcare. You could at least get a job that pays bills enough to survive. That's the foundation of most jobs is a high school diploma. Yeah.
Correct.
And the more you get, the better. Go ahead.
Yeah. And then I was gonna say, as I was preparing for today's session, I was thinking, you know what? Let me take some time to review health disparities, but also health inequities. Now, health inequities are health disparities that are deemed unfair or stemming from some form of injustice.
Okay, let's talk about it. What is a health inequity?
Health inequity, health disparities that we see,
It's just a
the different,
difference.
the difference is that are deemed unfair. So, hey, me and you have similar income comparison to Jon Snow, but when we go to get service, when Serena Williams go get service, in comparison to somebody else, hey, something happens. She don't get what she needs. She don't get the care that she needs, and it could be due to some unfair or something stemming from some form of injustice, where the provider may say, "Hey, I know you look like you're in pain, but you're not really in
Not really in
pain.
pain.
Are you really in pain? You know what?" Which goes back to the past, the preconceived ideas, even
Biases.
though you may have the money. So even though right now we may have the funds to do XYZ, that preconceived idea can be one of the contributing factors to health inequities.
And that's critical because if I or Serena Williams, who makes millions of dollars, right, dies prematurely because they didn't listen to her because of the blood clots, right? She had to be a strong advocate for herself. She almost
Yeah.
died. Serena Williams, millionaire, almost died. If she had have died, all those millions would have been gone, right? Those potential millions would have been gone,
Yeah.
and that would have contributed to the economic burden for African Americans. And that's what we're saying. Sometimes it has to do with us, but a lot of the times it has to do with systems out here. Bias systems. You have medical school students who when surveyed said, um I think African Americans, because of their skin texture, feel less pain. They literally think biologically they are different to the point where they don't feel as much pain as other people. That's why I'm so wary of this concept of genetics causing these disparities. Majority of these disparities, these health disparities, are racism induced. They're racism induced, not race induced, but racism induced, right? Lack of education is one of the major contributing factors. And the lack of education in many of these states are not because of the not wanting of education by these black people, these Latino people. It is because there are systems in place to remove education from people. In many states, education is based on, like you said, the housing values. So if I live in a poor community and a poor housing value, then I'm going to get poor education, and the cycle continues. But that's not the
Yeah.
only thing. I could be rich and still, because of, on top of that, inequities, biases in the healthcare industry that can also contribute to it.
Mhm. Yeah.
Yeah. So what's the solution? What's the answer? How can we fix the problem?
Like I said before, first thing we need to figure out is what can I do to make changes within within myself, whether that is okay, instead of me doing this, instead of me buying this, buying that, what can I do to invest in myself, to not invest in other people or in other products? What can I do to invest in myself? And that will and that can consist of eating differently, making healthier choices, going to bed earlier, um, getting a good night's sleep, eating breakfast in the morning. That can also include, you know what? Let me stop buying soda because soda contributes to weight gain. Soda contributes to
Sugar in the
um,
blood.
the sugar, to diabetes. Let me stop eating out as much. But the goal is, let me control me. As you work towards that, you know what? Let me go to my city council meetings.
Mm.
What is happening? Oh, this multi-unit is going here. Where's the park? Where's the place where there are more trees? Let's build some sidewalks because there are no sidewalks here for me to walk on. So once you figure out what can I do for myself, let's now get involved in civic duty,
Love it.
or let's run for office to make changes.
Love it, love it, love it, love it, love it. So I hear the answer is make personal changes that you can change. You can't, you know, what I'm trying to do is drink more water. I'm trying to drink water every day, at least 64 ounces. I want to get 96 ounces the most, but at least
Yeah,
64 ounces a day of water. That's critical. I want to exercise every day. That's very critical, right? I'm That's one thing I'm trying right now. I'm gonna do better at eating one step at a time.
no, one step at a time.
One step at a time. But you gotta live, right? So the reason why there's great health disparities is because one of the major reasons in terms of African Americans, I'll say, is because we're dying too early. What was it for Latinos? I think Latinos and Asians and other minority groups is
Yeah,
because of missed. income because of like
Yes.
healthcare issues. You didn't die early, but because you were sick, you weren't able to work. You had a good job, but because you're sick, you left you have to leave the job for some temporary time, and that leads to loss of income. So that's
Yes.
another reason why
And
you
then
could live to 70 to 80, but if you're constantly in and out of the hospital, you're not making the money that you could if you were well.
yes. And then on the other hand, if you are working, if you're working, even though your retirement age is 78 and you get to 78, you may not have a pension because the job you got. So you're working. Some people live just to work
Yeah, they
because
don't
they
have
have to
Roth
work.
IRAs, they don't have pension, they don't have
They don't have none of that.
401ks because they only have,
Yeah.
and that's the education piece. That's why there's a direct link between the education levels. Usually people with high levels of education have the 401ks, they have the Roth IRAs, they have the pension plans. Are you hearing me, guys?
Yeah.
There's a direct connect. So don't let anybody tell you you don't need an education now.
Yeah.
I'm telling
Yeah.
you.
So I want to say this for those who are working regularly now, working. Start putting. I'm jumping into business.
Uh-huh.
Start focusing
It's
on
phenomenal financial
IRAs.
freedom, kid. That's what
Yeah,
we supposed to
financial
talk.
freedom. Yeah, put some money on the side, $5, $10 here, and then start a side hustle. I know it's crazy, but start something small because most people who are millionaires or people who are well, they have multiple streams of income, not just one. They might have two or three. So hire your brother to work on this project to bring in extra income, or you do it yourself. But that's another way to be able to be help reduce your economic burden, or yeah, reduce your economic burden and help increase your health and wealth.
Love it, love it, love it. All right, guys, there is a direct connect between economics and your health. And what we learned today, to just to close off, is we're not making enough money due to the lack of education. We're not getting enough good enough health care because of that, or we're not in environments that promote health because of that.
Mhm.
Um, or it could be vice versa, because we don't live in good environments, we get lack of education. It's just a spinning cycle, but nonetheless we're dying prematurely, and when we die prematurely, we're not able to generate wealth for ourselves and our families. So health is wealth. I just want to remind you I want to remind you that you can subscribe to my YouTube channel, Dr. Maya Byfield. Please do me a favor, subscribe. And lastly, my book is out. The Phenomenal STEM is how to prepare a student from the womb to the university to be excellent in STEM. I'm telling you, when you have a STEM career, people with STEM careers outpace all other careers in terms of wealth. And when you have wealth, a lot of the times you have health. So education is a strong connection, and specifically a STEM education. A STEM education will give you high amounts of health, but not to say that you just because you have one you're going to be healthy now. Because I'm still working on my health. I need to get
Mhm.
myself together. And there's some cardiologists that they die early because they're so stressed. So some people with the most
Yeah,
education, they have the worst behavior. So you can't education is not the only way.
yeah,
But what we're seeing in terms of the numbers is that a lack of education is the main way. It's the main way, the main reason. Yeah. Go ahead, Ken. I'll give you the last word.
yeah. Like you said, it starts with a dream, a dream to be this or to be that, or to become a physician or podiatrist or a scientist. It starts with that, but that dream starts when we're young. Grade school, exposure to other environments, to other people. It starts when fifth grade, fourth grade, and yes, our environments, in my environment, public school. Schools were crowded, but I had people that had I had parents that instilled in me a desire to do more,
Yeah.
similar to Dr. Byfield. And yes, we even though we lived in certain environments, we have people we could rely on. We
Yeah.
we have people that we could have seen, hey, if they're doing X, I can do X too. So it starts with a dream, and then that dream kind of provides that fuel to help you to get through high school, junior high, college, as you work towards making those changes to be able to get a good education, to reduce your risks of chronic disease by understanding, but also making more.
Yeah. 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 All right, guys. I'm the phenomenal STEMist. So see, thanks so much for being here with fourth quarter limit living Ken. We'll see you next month. And I don't know exactly what we're going to talk about, but of course, it's going to be talking about the direct link between health and wealth. Health is wealth. Thank you all. You guys have a good night.
Take care.